Good evening, everybody. We'll get started in just a few seconds, just waiting for everyone who has been waiting to get admitted to the Zoom room before we get started. So thank you for your patience. Again, we'll get started in just a second. All right. Hello, everybody, and thank you for joining us this evening for You've Been Diagnosed with Cancer, What's Next? My name is Kate, and I'm with Nebraska Medicine, and I'm here to go over just a few housekeeping details before we turn things over to Dr. Laura Tenner for tonight's presentation. First of all, just a reminder, this is a general discussion. It's for informational purposes only. If you have any questions that are specific to your health or medical condition, you want to, of course, direct those towards your primary care provider. This webinar is being recorded, but we do want to let you know that your name and information will not be shared. We have a brand new feature this webinar for the first time. You'll notice on the very bottom of your Zoom screen on the far right, there is a closed captioning function. So if you click on that live transcript, you will be able to add subtitles to this recording if you would like to listen as well as to watch tonight's presentation. And of course, questions are welcome. That's why this is a webinar. It's interactive. We encourage you to participate. Please use the Q&A function to submit your questions. I'll be keeping track of those during, and then after the presentation, we'll present those to Dr. Tenner. The chat function is also available, but please use that if you want to communicate with a member of our team or if you're having any technical difficulties. The Q&A function is what we will want you to use to submit questions. So on that note, I am happy to turn things over to Dr. Laura Tenner, who is a medical oncologist, and she's got tonight's presentation for us. Thank you so much for your time and your expertise, Dr. Tenner. We appreciate it.
Thanks, Kayla. I appreciate the introduction, and I appreciate the planning committee getting this all set up for me because I love talking about cancer survivorship and talking with cancer patients and family and friends of cancer patients. So thank you all so much for joining me tonight. We wanted to talk about kind of life after that diagnosis of cancer. And we talked a little bit already about some disclaimers. I'm gonna give you a few more, but also we're gonna really kind of hit on I've got 20 minutes tonight, so I'm really just gonna hit on some very common questions and some recommendations that I literally can't get through a clinic day without talking to my cancer patients about. So I'm hoping they'll be also relevant to you all at home, and you may be having the same questions as well. Just like Kayla said, this talk is going to be a general information talk. I'll be talking about nutrition and recovery after diagnosis of cancer, that individuals hopefully can make informed lifestyle choices in cancer survivorship. But please remember the information contained in this talk is in no way specific to any one individual or cancer type. So you always want to take the recommendation of your medical oncologist or surgeon for your particular issues over any advice given in this talk. A specific example for that would be, for example, right after a colon cancer surgery, you're recommended not to eat fiber. And I'll be recommending in this talk for general wellness to eat fiber. So you can see some variations there. So if you've been told something specifically by your medical oncologist or doctors, then do follow those guidelines. This is, of course, is just a general informative session. We'll be talking about cancer survivors today, and basically the definition of a cancer survivor is anyone who has been diagnosed with cancer from the time of diagnosis through the rest of their life. We generally like to divide that up into 3 different phases. There's the active treatment phase where people are going through either some sort of directed active treatment for their cancer. There's the living after cancer treatment phase where individuals are trying to now live their best life in full wellness. After they have gone through either some sort of chemotherapy, immunotherapy, directed therapy, surgery, etc. And then there are individuals that might be further down the road and require some advanced cancer and end-of-life care. But the ones that we'll be talking about in this particular talk today will be that second phase. So that's where you're living after an active cancer treatment. So you maybe completed a chemotherapy, directed therapy, surgery, radiation, and you're moving on trying to live your best well life. I want to start with some common questions that I get from lots of different patients. I'd like to call them myths. With every single question, there's always a truth component to it. And then there are some other areas that we have to kind of clarify a little bit better. And these are ones that patients commonly ask me. I don't think I've ever gone through a clinic day without hearing one of these questions. So it may be something that you've also heard as well. The first one, I think, and the most popular one is that patients come in and tell me that people have told them, don't eat sugar, it'll make your cancer grow. And their question to me is, should I remove all sugar from my diet? So there are, like I said, some true components to this, and then some things that we need to delve in a little bit more to. The true component is that cancer cells do use sugar. And by sugar, we mean the basic building block of sugar, which is glucose for energy, okay? But so do our healthy cells. And cancer cells are really just healthy cells gone wrong, okay? So if you were to completely remove all sugar, you wouldn't just starve your cancer cells, you would starve your own cells. The false statement is that depriving cancer cells of sugar by eating less sugar will not slow the growth of cancer. Our bodies have mechanisms in them that we will break down our own protein, our own muscle, and make that into sugar if we starve ourselves. So what ends up happening if you try and starve yourself is that your body will break down your muscle, and the cancer cells will then chew that up and eat that. So it wouldn't be helpful either way, okay? What is true, however, here in this situation is that you don't want to eat bad sugar or refined sugar, right? Try and eat healthy sugars that improve your diet. Things like fruits are healthy sugars, right? You want to stay away from the candy bars and the cupcakes and that kind of stuff, okay? So that is still a truth, and you should follow that. But on occasion, celebrating a birthday or something like that is not going to worsen your cancer. I also have patients ask me questions like, I've heard that eating organic is helpful in cancer patients. So should I only buy organic foods? So I think some individuals choose organic foods because of beliefs in farming sustainabilities and other things. The problem with organic foods is that they can be cost prohibitive. Okay, they're very expensive over normal fruits and vegetables. Either way, you need to make sure to wash your fruits and vegetables very well, whether you get organic or not, okay? But organic foods are basically foods that are grown without synthetic fertilizers and pesticides. So when we look at the research, does eating organic food just benefit and maybe prevent from cancer recurrence? There isn't any benefit necessarily within the research to show that there is a significant benefit for just eating organic foods. What we have shown in research is that there is benefit in eating fruits and vegetables, whether they're organic or not. So we're recommending eating fruits and vegetables. If organic foods are cost prohibitive, get the other fruits and vegetables, because that is what is most important. You need that good fiber, you need that healthy diet, okay? So if you choose to eat organic foods, that's totally fine, but it is not a requirement for healthy living and to prevent further cancer recurrence. I also get a lot of questions about alkaline water, right? So patients say alkaline water prevents cancer, and should I just be drinking alkaline water? When we actually look at the data, where this data came from is what they did is they took a Petri dish and they put some cancer cells in the Petri dish and they poured the alkaline water in. Alkaline water is basic water. So you have acidic water and you have basic water, and alkaline is another name for basic water, okay? And it is true that cancer cells will lyse or be destroyed in basic water. So when we poured it into that Petri dish, those cancer cells died. However, if you put your normal cells in that Petri dish as well and pour in basic water or alkaline water, they will also lyse. Our normal cells have to maintain at a pH of 7.4, okay? Any fluctuation above or below that pH will cause our own normal cells to have a lot of problems and die. And so there really isn't any evidence in terms of drinking alkaline water that is actually going to benefit you one way or the other, because our bodies tightly regulate that pH between our lungs and our kidneys. So no matter what you do, drinking acid, drinking alkaline, your lungs and your kidneys will help regulate that, okay? It's like drinking soda that has a more acidic property to it, and yet our body stays at a pH of 7.4. Same thing with alkaline water. So if it tastes good to you, that's totally fine to drink. It won't hurt you one way or the other, but it is not going to help prevent cancer growth. And then the final one is hair dye use increases the risk of cancer. So my patients ask me, can I continue to dye my hair? This one has a lot of controversy with it. And currently there's not really any convincing scientific evidence that personal hair dye use increases the risk of cancer. We have about 10 studies that don't show any correlation. We have about 4 studies that do. You probably have heard of the most recent study in 2019 that came out that said they showed a correlation between permanent dyes and breast cancer. Okay, but what happened in that group of the permanent dye group, they also had a higher rate of tobacco abuse, hormone use, and we're from a lower socioeconomic background. So 3 different things that we have known risk factors for breast cancer. And so it is not clear whether it was the hair dye that was causing the increased risk of breast cancer or those other 3 factors that we know cause a risk for breast cancer. So there really isn't a clear-cut case. Now, the one thing that study in 2019 did show that was interesting was that there was a significantly higher correlation between permanent dyes in African American or Black women. We actually had a study done prior to that in the 90s, specifically looking at Black women health study, and that did not show a correlation with hair dyes. So, I don't think there is any definitive evidence right now that says hair dyes will cause breast cancer. But if you're worried about it, maybe use dyes that are not permanent. There are, however, some studies that suggest that hairdressers and barbers who are constantly working with their hands using those chemicals, they can have an increased risk of bladder cancer. So there is somewhat of a correlation with that. Okay, so I'm going to get into some of the recommendations, and these are just kind of the baseline things that I like to tell my patients as we go through. These are the things that there's lots of things in cancer that you don't have control over. And I like to say these are the things that we can focus that you do have control over with cancer diagnosis. These are the things that you can do on an everyday basis to help improve how your body does and your own personal wellness. The main 3 recommendations have to do with weight management, physical activity, and dietary patterns. And of course, the latter 2 really inform the weight management, right? Physical activity and dietary patterns. We've discovered that when people focus in on these, that their risk for recurrence of cancer is a lot lower, that they have better quality of life, and across the board, just really do better. When we talk about weight management, exercise has been shown to improve cardiovascular fitness, as well as other things like mental health and quality of life. So it's a very helpful thing to kind of focus on maintaining a lower weight or losing weight. And in about 20 different prospective observational studies, so a preponderance of evidence has shown that physical activity in cancer survivors lowers the risk of cancer recurrence and has improved survival compared with those who are inactive. So just being active is the important thing. When we talk about activity, we have specific guidelines through our U.S. Department of Health and Human Services. And specifically, they break it down for adults. So these are individuals 18 to 64. They recommend at least 150 minutes per week of moderate intensity or 75 minutes per week of vigorous intensity. And we'll talk a little bit about what moderate intensity is and what vigorous intensity is here in just a minute. But remember the 150 minutes of moderate or 75 minutes of vigorous. Now, they also comment on adults older than the age of 65 years, okay? They also recommend to try and follow these guidelines if possible, but if you have chronic conditions that limit that activity, then just try and be as physically active as your abilities will allow, okay? So they want you to be safe in your exercise, don't push yourself too hard, but you do want to try and remain active, okay? It's the inactivity that is the enemy here. Try and avoid long periods of inactivity. When we talk about moderate versus vigorous activity, how do we define that? So I love this definition because I feel like it's an easy thing to remember when you're in the midst of your activity to kind of see where you're at. Moderate activity is that I can talk while I do the activity, but I can't sing. So if you're able to talk to the person next to you on the treadmill, that's moderate activity. But if you try and sing a song while you're on that treadmill, which I don't think the person next to you would appreciate, but that's okay. Then if you can sing the song, then you probably need to pick up the pace a little bit. If you can't sing the song, and you hit right where moderate activity should be. Vigorous activity is where you can only say a few words and then you're kind of trying to catch your breath. Okay, so that's where you get to vigorous activity. It's where you get that little bit of breathy, you can only say a few words before trying to kind of snatch that extra breath. They give examples of each, moderate and vigorous. Now, depending on where your particular exercise is, general guarding may be moderate for one, but vigorous for another. So using those definitions, I think, can be very helpful in terms of where you are with your activity and how many minutes you should do. Again, the 150 minutes of moderate, 75 minutes of vigorous. Patients ask me, what's the best diet? Okay. And there's lots of fad diets out there. And I will say, if you're looking at a fad diet, if they're cutting out a whole food group, it's probably not the best diet for you. Dietitians and nutritionists still recommend a well-balanced diet. And I think that we have the most evidence to support a Mediterranean diet. So here you have a Mediterranean diet pyramid. Notice that it's very heavy in the fruits and vegetables and whole grains, okay? It also, when you look at the meats that are associated, there are white meats as opposed to red meats, so fish and chicken as opposed to steak and other things, and that there are still fats here included. So you want to have a well-balanced diet, but you want to have healthy fats. So we'll talk a little bit and break some of these things down. So there's really no difference between low fat and low carb diets as long as the calorie intake decreases. It should show benefit in terms of weight loss. You want to avoid trans fats. So you want to eat healthy fats. So fats like using olive oil for your fat as opposed to a butter or margarine. Those are some of your healthy fats. You get healthy fats from fish, okay? So when you are trying to incorporate the fats into your diet, try and avoid those trans fats. We want you to increase the intake of vegetables, fruits, grains, beans, okay? So like we said before, if the organic fruits and vegetables are cost prohibitive and you're not buying them because they're too costly, switch to non-organic and use those. It is so important for you to get your fruits and vegetables in. We recommend increasing your white meat intake, so fish and poultry, as opposed to your red meat. You should only eat less than 18 ounces per week of red meat. So you can't have a hamburger every night and include that as a healthy diet, okay? We want to limit that red meat. Red meat has been shown to have higher correlations with things like colon cancer and other issues. We would prefer that you eat whole fruits instead of juices or anything with added sugar. So try and stick to the whole fruits. I oftentimes have patients juice or throw in some vegetables in with those fruits into a blender and make a nice little smoothie. So that's a good way of getting all of those in. We want you to use low fat rather than full fat dairy products. And tree nuts are very healthy. So including almonds, walnuts, cashews into your diet are a very healthy thing. And those are included in that Mediterranean diet. What is a tree nut? It's basically anything but a peanut, okay? Peanuts are actually considered in the legumes category. So make sure to include nuts into your diet. Those are actually protective against things like colon cancer. And like I mentioned before, cooking with things like olive oil. There were some promising studies in terms of turmeric and cinnamon in terms of protective qualities against cancer. But I want to talk to you a little bit about vitamins and things like turmeric and cinnamon. What we found in both observational studies and clinical trials suggests that dietary supplementation are unlikely to improve prognosis or overall survival after the diagnosis of cancer. And some of them may actually increase mortality. So be very careful about the pills that you choose to take. When we're talking about turmeric and cinnamon, you want to try and incorporate those into your diet because that's the best way that you absorb all those good nutrients. Same thing with any over-the-counter vitamins, pills, supplementations. Actually, the recommendations now are shifting away from taking that daily vitamin and just trying to have a very well-balanced diet. Now, the exception to this is if you have a deficiency in something, so like a deficiency in B12, then we would recommend taking a B12 supplementation, okay? But if there's no deficiency and you're just taking something for wellness, we would recommend trying to incorporate that into the diet as opposed to taking an additional pill each time. And then finally, and lastly, I want to talk to you about alcohol. I get this question all the time, and I feel like patients are always asking me, hey, doc, can I have a drink every now and again? If the guys come over and we're watching a game, can I have a drink? I think the first thing we have to do when we talk about alcohol is we have to talk about what is the actual standardization of alcohol, okay? What is the size of each glass so that we're on the same page? A beer is 10 to 12 ounces, okay? That is one beer. A wine glass is 5 ounces, and that is equivalent to a 1.5 ounce shot, okay? So if you pour yourself a 10-ounce glass of wine, you just had 2 glasses that night, okay? And the reason I say that is because I have patients that come in with this glass, and that is not 1 glass of wine, okay? So we want to make sure that we're all talking about the same thing. So the American Heart Association, the American Cancer Society, and the Department of Health and Human Services all recommend that men drink no more than 1 to 2 drinks per day, that women drink no more than 1 drink per day. And 1 drink per day is not that glass, right? 1 drink per day is a 5-ounce glass of wine or a 10 to 12 ounce beer. If you get a 40 of beer, then that's 4 servings of it. Okay, that's 4 glasses. So just sorry to disappoint you all, but just so that we're all on the same page. The recommendations are really shifting to try and avoid alcohol completely. We recognize, though, that that may not be conducive to most people's lifestyle. And so I would recommend following these guidelines: 1 to 2 for men, 1 for women. And that also, this is the other question I get, that doesn't mean you can save up your 1 glass a day for 7 days and then binge on the weekends. Sorry. It means within a 24-hour period, you can have 1 drink. Once that 24-hour period has gone over, you start over again with just allowing 1 drink, okay? You can't save up for the weekend. So I hope some of the things in this talk were questions that you had, or maybe there were things that you knew and they were just reiterated for you. We like to focus things on evidence-based medicine, and I just want to make you all aware that we are going to have a survivorship conference on June 3rd, Friday, June 3rd. Registration is now open, and this is the website to go to register for that conference. We're really excited about it. There'll be more like what I just talked about here in this short presentation, to much more detail. And if you register and come, we're going to be focusing on the evidence-based medicine behind a lot of these recommendations. So why do we recommend the things that we recommend, and what are the things out there that people should be doing? This is open for anyone in the community, whether you're a cancer patient, a cancer survivor, a family or a friend of someone with cancer, or whether you're just interested in some of this information. Please do come and sign up. We have a lot of great talks, but I want to show you that the keynote session is going to be on complementary and integrated medicine. So we're talking about herbs and supplements. Lots of patients have lots of questions about this, and this speaker is going to be great. So please do consider joining for the conference. We'll also be talking about secondary cancers, sexual health for men and women. We'll be splitting those 2 conferences up so we can really delve into each one of those groups. Marijuana use and cancer treatment, prevention, whatever. This is going to be a huge talk, I think, because there's a lot of interest out there about marijuana use in cancer care. I'll be giving a talk on the financial toxicities that come along with a cancer diagnosis and cancer treatment, and how to kind of move through those kind of things. There'll also be mental health and genetic discussions. And we're going to end that half day with a nutrition food demo. So if anything, hang around for our nutrition to give a really cool demonstration about how to do some healthy cooking. So I want to thank you all for joining in, participating, and I look forward to all of your questions.
Thanks to all of you. Double punched my unmute button. I'm sorry for watching. Again, if you have any questions for Dr. Tenner, you can go ahead and type those in the Q&A section right now. We do have some people who have been watching who are curious about how they can best support a family member. Maybe they don't have cancer themselves, but they're looking to kind of be helpful when it comes to maybe some of these lifestyle changes. What's the best advice you have to offer them?
Well, I think the first thing is being in the know about the evidence-based medicine behind all of this. So the fact that you joined this tonight is a great start. Also, joining yourself or having your loved one or family member join for the conference in June. I think they'll get a lot of good information and maybe kind of validate some of the emotions and things like that that they're having with this. And so that's always a great way to start. We have a cancer survivorship clinic at Nebraska Medicine. So even recommending getting that individual into a one-time visit with us so that we can sit down and kind of go over a plan with them about further testing they need, surveillance, how to live best in their wellness with mental health, with diet, with exercise, etc. We can do a specialized and individualized appointment with them for that as well. And I think the American Cancer Society has a lot of very neat support groups and websites to join. So there's always those things if you have, want to kind of build up a community. And we also have a support group at Nebraska Medicine if you are looking for kind of a community of support for that individual.
I do want to point out, we did have one question about the cost of the conference. It is free. It is virtual, so you can do it in your pajamas or whatever you choose to wear. I know we've gotten used to some of these virtual meetings, but it's a great opportunity to get some good information from the comfort of your own home. A lot of talk, I think, especially with COVID and everything that people are going through, a lot of recognition about like mental health and more people embracing therapy or meditation. Are those things that also can help cancer patients who maybe haven't thought about doing those things previously, but need some help kind of just coping with the stress of a diagnosis?
Yes, absolutely. So mental health is a very important thing, especially in cancer survivorship. But I think even more importantly now, while we're undergoing COVID, where we're being separated from who our normal support group may be, we're having to not do a lot of the things that we might normally enjoy. So trying to kind of revamp the way that we do things and rethink about the way that we can live in a good mental health is very important. There actually has been a significant increase in different kind of applications, both apps for computers and phones that may help people in terms of meditation, in terms of sleeping at night. But it is very important in addition to be evaluated and kind of seek help, counseling. We have counselors at the Cancer Center for people with cancer who are undergoing a lot of stress and strain, especially right now throughout COVID and with their diagnosis of cancer. We also have significant data moving forward. I think some of this will probably come up at the conference too, about how the effects of COVID specifically on cancer patients has been quite devastating in terms of things like following up surveillance, colonoscopies, mammographies, et cetera. There's been a huge hit for any kind of cancer survivorship wellness in terms of surveillance and following up. And I think that's been a huge toll on the cancer community. And so trying to regroup from there and regrow is a big arena that we're looking at right now so that we can better serve our cancer survivors.
Another question that came in was guidance on the recommended number of meals per day and portion sizes. Some people like to eat 6 small meals a day. Some people eat the normal 3. A lot of people skip breakfast these days. Does that matter?
Yeah, I think that's one of those things that is, no, there's not a general guidance for that. There is a particular calorie count that people typically look at, and it depends on if you're trying to maintain calories or trying to lose weight. You want to focus on the calorie count. And then depending on that calorie count, you can have 6 or 7 small meals in a day versus 3 regular size meals in a day, et cetera. There's been some more evidence and data looking at having these breaks in between eating and having kind of almost like starvation periods and some of those diets. And there's more evidence coming in about that. But for the most part, I think it just depends on the particular individual and what they've gone through. I know a lot of individuals that have undergone colon cancer, resection, for example, sometimes do better eating 7 small meals in a day as opposed to 3 regular size or large meals, as opposed to other patients who have a better routine kind of keeping the 3 meals. So it's whatever fits within your particular individual arena, but I would just say focusing more on the number of calories that you have in a day. Maintaining is about 2,000, trying to lose weight, you're looking at about 1,200 to 1,500 calories in a day. If you're working on trying to gain weight, because after a cancer diagnosis, sometimes we lose a lot of that, then you want to eat more than 2,000 calories in a day. And however you do that comfortably is the most important.
I know you mentioned earlier the studies, like when it has to do with hair dye, there were 10 studies this way and 4 studies. I think if you're trying to inform yourself, the amount of information that's out there on the web can be a little intimidating.
Yeah.
Do you have any advice between keeping yourself informed, but also like not getting bogged down by it?
Yeah, I mean, that's a great question. And that's actually very hard to do, I would say. You're kind of constantly bombarded by, I like to call it sensationalist news. So, like, anytime something comes out, there's always this headline that seems very dramatic. And then once you kind of get down into the weeds of it, it may not be as dramatic. I would say for the most part, you want to try and kind of take everything with a grain of salt and have a little bit of a critical eye for most things. Anything that promises a cure for cancer, anything that promises a one-stop shopping for all ailments, those are generally not going to be things that work. Okay, and this is something that I my cancer patients about, because there are a lot of things on a lot of websites out there that promise you cure, or that promise you, the best wellness, and if you spend a substantial amount of money on something that they have for you. So you just have to be very careful about that. For the most part, when we're looking at causality, so for example, the hair dye example, when some does using permanent hair dye cause breast cancer? Causality is a very difficult thing because there are a lot of other influencing reasons people develop these cancers. And so, especially in those instances, I would take that with a grain of salt. I think there have been a lot of studies looking at whether soy is beneficial, and then it was harmful, and then it was beneficial, and then it was harmful. So when we're looking at studies for causality, I think it's really hard to ever pinpoint that one thing is the cause. There would be exceptions to that, where we have 50 and 60 years of substantial data, and that would be tobacco smoke, right? So any tobacco use, we have significant preponderance of data that tobacco does cause cancer and multiple types of cancer, okay? So when you're looking at these studies, you're looking at what we call a preponderance of data. You hear me use that phrasing a lot, because in science, that's what we use to help identify whether something is truly, can it be proven again and again and again? And if so, then we know that has an extremely high likelihood, if not is the case. And so that is something we see, for example, in tobacco, but yet we don't have the preponderance of data yet in hair dye.
Thank you, Dr. Tenner. Just kind of a snapshot of general information. As Dr. Tenner mentioned, that Cancer Survivorship Conference is coming up on June 3rd. nebraskamed.com/survivor events is the link where you can find that, or just go to the website and type Cancer Survivorship Conference in the search bar, and that'll pop up. We'll have an opportunity to get a little bit more in depth there. So Dr. Tenner, thank you so much for your time and expertise. For everyone who is watching, just one more note, you will be sent a recording of this webinar. So if there's anything you missed or want to share with a friend, you can look for that email coming soon. So thanks again, Dr. Tenner. We appreciate your time.
Thank you all.
All right. Thanks for watching, and have a great evening, everybody.